we are trying to develop is to develop novel biomarkers that are non-invasive, so that can be tested in the serum of patients, and that can reflect the reservoir of the virus in the liver, and mainly trying to reflect the cccDNA in the liver. So the first interesting biomarker is the viral RNA in serum. And why do we need these biomarkers? Is because we have seen that quantitative HBs antigen is not sufficient to predict the pool of cccDNA, because HBs antigen can come either from cccDNA or from integrated HBV DNA. So if we are looking at new treatments or new strategies aiming at curing the infection and eliminating cccDNA, then quantitative HBs may not be the best marker because it can come from the integrated forms. So we need to have biomarkers that come that really reflect cccDNA. So the first one is the viral RNA in serum. And when we say viral RNA, we really need to mention that it should be the pregenomic RNA in serum, because pregenomic RNA comes mainly from cccDNA and not from integration. So this biomarker is very interesting. There are several studies that have shown the correlation between pregenomic RNA and the transcriptional ability of cccDNA in the liver. Now there are novel tests to measure the pregenomic RNA. So they are, at the beginning, they were mainly laboratory developed tests, and now they are really more robust tests that are developed by diagnostic companies such as Abbott and Roche Diagnostics. And we have seen very interesting studies on that, and maybe we can come to later on the results. So these biomarkers and the assays are now in development. We have seen many studies at AASLD that have used the pregenomic RNA as a biomarker. The second one is the HBc-related antigen or correlated antigen in serum. So this is this time it's an ELISA. So because we are measuring the protein, not the RNA. So the other test was a PCR-based assay. Here it's an ELISA for correlated antigen. It reflects the expression of core protein and proteins that are related to core, as well as HBe antigen. And it is also thought to be the reflect of cccDNA because it's mainly expressed by cccDNA and not by integrated forms. So there are several studies that have shown a correlation between the correlated antigen in serum and the cccDNA ability to transcribe viral RNA. So it's a very interesting test because it's an easy test, an ELISA that reflects the reservoir of transcriptionally active cccDNA. Many studies have been performed to show that. And yes, I mean, and the assay is developed by Fujirebio from Japan. So that's so here it's also a robust assay developed by diagnostic companies. So we have now these different biomarkers, and there are clinical studies ongoing. Maybe we can talk about them at the next question. So since these biomarkers are very important, they have been used in clinical studies. So regarding nucleoside analog therapy, so the drug that we currently have, well, one of the big questions is whether we can stop nucleoside analog at some point and not doing lifelong therapy. In that setting, the question is whether stopping nucleoside analog therapy will allow relapse of the viral replication and inflammation, which will be followed by the clearance of HBs antigen, so which will increase the rate of HBs loss. On the other hand, the other scenario is that the relapse of viral replication and inflammation may just restart the chronic liver disease. So there are the two main scenarios, and it's important to predict before stopping treatment what are the chance or the risk for the patients to either lose HBs antigen, which would be very favorable, or to have a severe relapse or an active relapse of the disease. So up to very recently, it was the field was very confusing. There was no predictors. There have been several presentations at the AASLD looking at the risk of relapse or the risk of the chance of having HBs loss. Again, not very easy to have a simple take-home message. The easiest biomarker so far was quantitative HBs antigen, because HBV DNA is undetectable by definition because patients are already on nuke. And it was suggested by different studies, and again at AASLD, that the lower the HBs antigen is, the higher the likelihood of losing HBs antigen. But the predictive value is not very strong, so that's a problem. So now adding pregenomic RNA and correlated antigen at the time of stopping nucleoside analog may be of very good value. So there are several studies from different parts of the world, in China, in Japan, in Western countries, suggesting that combining the three markers could add a better predictive value. So if patients have low HBs antigen, lower than 100, undetectable pregenomic RNA, and low correlated antigen, then their chance of losing HBs antigen may be higher. But I think we will need to address that in a prospective manner, because most of studies were done retrospectively. The analysis of the biomarkers was done retrospectively. So it seems that we are going in that direction to have to use these three biomarkers and try to find the best threshold for the different biomarkers together and build algorithm to predict. And I think that will be very important. For novel therapies, it's also very interesting in clinical trials with novel mode of actions. But we need to learn. And we have seen very interesting studies with capsid assembly modulators, siRNAs during AASLD, and as well as combination of capsid assembly modulator and siRNA. And we've seen studies of exploratory endpoints. So we're using correlated antigen and pregenomic RNA in serum. And I think we are learning together with the new drugs, but also with the new biomarkers. So it's still a little bit early to say how to use these biomarkers with the new drugs, because these are two new things, biomarkers and the drugs. But the studies are really interesting, and I'm sure it will be very helpful to have these novel biomarkers for the monitoring of the efficacy of the novel antiviral treatments. I think as I said at the beginning in my response to the first question, it was very nicely shown by different investigators independently that pregenomic RNA and the correlated antigen are really good biomarkers of cccDNA transcriptional activity. So I think they are very interesting. So they are non-invasive by comparison with the liver biopsy that is required for cccDNA analysis. So they are non-invasive. So that's very good, very important. Question will be how are we going to use these biomarkers? Will it be as a better class as tools to better classify the patients in the different phases of the disease, from immune tolerant to chronic hepatitis to inactive carriers and so on? Will it be, so that's one possibility. So we need to do more studies. There were some studies published recently by the NIH group, but we need to build on those studies to see whether these biomarkers can add some value for better characterization of patients, better diagnosis. Will it be a predictive value, so prediction of the loss of HBs antigens, so prediction of functional cure before HBs is undetectable? So that would be extremely important, and I think we need to have prospective studies where patients lose HBs to determine whether pregenomic RNA and correlated antigen was performing even better than quantitative HBs antigen. So we need these prospective studies to see whether these biomarkers will have a strong predictive value that we can use in the clinic. And the third application, I think, will be for the monitoring of the new drugs. But then we will need to learn how to use these biomarkers across all the different drugs, because depending on the mode of action of the drugs, the evolution of the biomarker may be different. So we need to learn with the clinical development of the new antivirals how to use the biomarkers to see how they will help the monitoring of patients. So I think we have really, I think it's going very well, and we are learning. And I think within a few months, we will 1 or 2 years, we will know much better how to use these biomarkers. And I think from AASLD, we've seen also new drugs in development, like we have seen capsid assembly modulators, we have seen siRNA, we have seen immune modulators, checkpoint inhibitors. We have seen yesterday a PD-L1 antibody in a clinical trial from China. I mean, all these are very promising, and we need to combine all these drugs together to cure the infection. And the use of biomarkers will be extremely important to assist the development of these drugs, and then later on in the future to manage the patients with chronic Hep B in the routine setting.